Welcome to this brief video abstract on our paper published in British Journal of Management entitled Value Propositions in Public Collaborations, Regaining Organizational Focus Through Value Configurations, co-authored by these five authors representing a Norwegian university and 4 universities in the western parts of Sweden, as well as a hospital from the same geographical area in Sweden. The empirical material draws from the same area in Sweden, as you can see in the map here, and represents cancer care and elderly care. In both these cases, collaborations were really essential. The Swedish population structure has been aging quite a lot the last decades. And the consequences of this is that more people live with multiple illnesses or chronic illnesses. So healthcare services needs to adapt and change to meet this new population structure. We conducted interviews and focus group discussions to collect data. In total, 52 different people participated in either of those: managers, nurses, nurse assistants, and physicians. We want to contribute to public service logic in this paper, PSL. And as we can see here in the background, we have 3 different papers published in British Journal of Management the last years on PSL. PSL draws from service management and marketing and tries to adapt this to a public sector. PSL builds on a critique against intra-organizational focus or manufacturing focus, in which value can be created within organizations and then delivered to passively waiting customers or patients. Instead, PSL favors value propositions, the idea that organizations or networks can deliver only potential value to public service users. This is then combined by the public service users in their unique life situation with other value proposition and resources from other actors to realize value. So a network logic is assumed in PSL, as you can see here in the picture. You have a patient, or in the center of this picture, integrating and combining different resources from a multiplicity of actors to realize value. We could find this network logic in our empirical data, but we could also find different other value configuration models. For example, the value chain developed by Michael Porter in the 80s, in which different predefined steps were really essential to develop value within organizations. That was really important to develop value propositions. Moreover, we could also see the value shop value configuration as important, in which different resources were gathered around the customer to identify and solve a customer problem as quickly as possible. So both these value configuration models were really essential to develop the value propositions in collaborations. As you can see here in this coding structure, we also have shop chain and network value configurations models found in both the empirical cases of this paper. So the conclusion here is that collaborative public management theories, including PSL, needs to recognize the importance of a multiplicity of value configurations, and that these value configurations often relate to both intra and inter-organizational processes. So not only intra-organizational processes as favored by network logic. Moreover, managers and other practitioners should not adopt the latest network trends without first reflecting on the relevance of existing internal processes. So please read our full paper and email me if you have any further questions. So thank you very much.